All right. Hey, everybody. Welcome to our contracted provider call for Tuesday, January 10th, 2023. Can't believe we're saying 2023 already. We're really glad to have all of you here today. We've got Nate Winters, the Deputy Director for Operations for the Utah Department of not Public Safety. I used to be a public safety, Department of Health and Human Services. I will get it right. And we're really glad to kick it off with him today. So Nate, do your thing.
Thanks, Joe. I mean, I'd love to be with public safety, but I think you need like certain credentials to be like a public safety person, and I'm probably not that guy. Again, welcome everybody. As Joe mentioned, I'm Nate Winters, Deputy Director for Health and Human Services. I'm grateful to be with you guys on this call. This is our quarterly provider call. And so just for those of you who are new to this call, our quarterly online provider meeting, division representatives will share some key updates with you, and then we'll go to open it up for some Q&A. So before we jump right into the meeting, I'll take some time and just kind of do some virtual kind of housekeeping reminders for you all, and then I'll kind of start off the meeting and jump in, and then we'll kind of roll through the different participants from Health and Human Services that have joined me on the call. So with that, virtual housekeeping. So closed captions are available for those who like them. Please click on live transcript in the menu bar at the bottom of your Zoom window to enable the closed captions. This meeting is being recorded, as Joe mentioned, for those who could not attend live. Once the recording has been rendered and uploaded to YouTube, we'll share the recording via an email to everyone who is invited to this meeting. At any time during the meeting, please enter your questions into the Zoom chat, and we'll do our best to answer all of your questions during the Q&A. If we are not able to get to your questions during the Q&A, we will record them and respond accordingly. In addition to questions that are being asked now, you can submit questions anytime prior to the meeting. You can do those by emailing DHHS_CQI@utah.gov. So housekeeping's taken care of. Let's jump in. I've got a slide deck. I think Joe will pull up for me, and we'll kind of jump in. So I'm going to cover some of the legislative items that have been included in the governor's budget. I'm just going to do some highlights, which means I won't be covering every item in the governor's budget associated with Health and Human Services. If you have interest in items that I have not brought up, feel free to look at the governor's budget at gopb.utah.gov or enter a question into the Q&A, and we'll try to get to it during the course of the call. So with that, I think, Joe, you can jump to the next slide. All right, so for you all, just a reminder, keep in mind the governor's budget proposals are not implemented without approval from the legislature during the 2023 general session, which starts next week on Tuesday. So what does that mean? It means that we've worked with the governor's office to get these items included into his budget so that we can then advocate for them during the course of the upcoming legislative session. They are not items that currently we have funding for, but we'll be working for and advocating, working with our legislative partners to make sure that they know and are aware of these priorities that are ours as well as the governor's. All right, you can jump onto the next slide. So the governor's proposed budget really was focused on three areas: people, growth, and good government. As is mentioned in the slide, historic investments in all three areas. And DHHS items will largely fall under the people category in the governor's budget, as well as the good governance areas. All right, we can move on. Okay, let me catch up. All right, so on this first slide, you'll see a handful of items that we've kind of bucketed under the strengthening services category. The first one, and again, these are not in any specific order, but the first one on the list you'll see is DCFS and JJYS provider continuum and Medicaid care parity. This funding includes a funding request to bring our non-Medicaid rates up to our Medicaid rates for the Department of Health and Human Services, particularly in DCFS and JJYS services, as well as provide a significant investment in increasing rates for foster care. So we're really excited about that, and for being able to help work through some of these rate issues that are not issues, but some of these rate concerns that have been brought to us due to the funding, the way that the rates are funded. The next up is home visitation. Home visiting would establish a continuum of home visiting services for new parents in targeted communities. Home visiting efforts create environments that positively affect a child's social and emotional development and prepare them for a productive life. So you can see the $15 million one time, that's money that's intended to be spread over a couple years, as well as some ongoing funding. Excuse me. All right. EMS, this funding replaces funding that was lost in the 2020 general session, as well as provides regional staff support in rural areas as intended in statute. So essentially, we've had for a couple years an unfunded mandate by the legislature to provide services, and are working to to meet the requirements of the law, as well as replace some funding that was lost previously. Forensic competency rate increases. This funding is intended to increase both the quantity and quality of our competency evaluations. It provides for increases to contracted evaluators, as well as funding for in-house staff and training. And last but not least, the DSPD waiting list. So as of the start of fiscal year 2022, 4,346 individuals were on the waiting list to receive services through DSPD. The number of individuals waiting for ongoing DSPD services is increasing. Between 2015 and 2022, the waiting list increased by 128%. This funding would ensure approximately 258 individuals could be brought off the waiting list to receive ongoing services through both the community supports waiver and the limited supports waiver. This funding would also help provide staffing within DSPD to help meet the needs of the additional work that they're taking on. All right, let's jump to the next one. So workforce support and pay, I think, we're not alone in this request. That I think we're all feeling the effects of a tight labor market and competing for talent out there. So the first one on the list is DCFS and APS employee compensation. So this provides funding for a funding increase, particularly for our DCFS caseworkers, an 18% increase, as well as providing other funding to address compression within the job series within DCFS, as well as APS. The next one is the Office of Medical Examiners. So this funding, about $2.4 million, addresses the longstanding operational deficits that have been exacerbated. I can't say that word, so we'll just roll with it. By increased caseloads fueled by Utah's population growth and increasing urbanization. And this funding is really intended to do a couple things. It's going to convert some contracted part-time investigators into full-time investigators, develop a more in-depth training, fully fund some of the epidemiology staff, and increase funding to OME rural scene response, and restore some funding to eliminate a long-standing budget issue that they've had. And again, last but not least, APS and OPG staff. So this is funding that's intended to provide for additional staff for APS and OPG to help with their increasing caseloads, as we kind of have the gray wave in Utah. As our population ages, we need to invest in our people to help keep up with the demands of the work on our aging and adult services world. All right, next slide. All right, so this one is under mental and behavioral health services. So you'll see at the top, school-based mental health telehealth services, about $4.5 million. And what this funding is intended to do is it's intended to purchase an additional, hold on one second, I got a dry throat. Doing too much talking. All right. So this funding is intended to purchase an additional 1,000 telemedicine kits for its school-based telehealth program to support nurses and to support school nurses in every K through 12 school in the state. These kits are really pretty incredible. I mean, they're not just for mental health. I think the intent is that they also be used for physical health as well. And these kits come with a tablet for secure videos, along with a Bluetooth-enabled otoscope, stethoscope, blood pressure cuff, pulse oximeter, thermometer, and exam camera. So we're really excited about the funding that can come about through this school-based mental health telehealth services. The next one's behavioral health crisis system. The behavioral health crisis system funding is to continue to expand Utah's crisis continuum of care. The request increases the number of mobile crisis outreach teams and better supports some existing teams, as well as adds funding for an additional receiving center. The request also adds 2 additional positions at DHHS to help support some of these efforts. And then the USDC Behavioral Health Services Unit is funding to contract for 1 full-time psychiatrist, 1 full-time psychologist to provide specialized treatment for individuals with comorbid diagnosis at the Utah State Developmental Center. USDC's current client population is represented by almost 74% having at least one psychiatric disorder. With that, we can jump on to the next one. All right, Medicaid. So we'll run through these Medicaid ones, and I promise this is my last slide. So the first one, 12 months postpartum. This request is to expand Medicaid postpartum coverage for pregnant women from 60 days to 12 months. Extending coverage beyond 60 days postpartum can reduce pregnancy-related deaths, reduce severe maternal morbidity, and improve continuity of care for chronic conditions such as diabetes, hypertension, cardiac conditions, substance use disorder, and postpartum depression. Medicaid for community health workers. So I think that's at the bottom. This request will add community health workers as an authorized provider to deliver services to Medicaid members. Community health community health workers provide support for members, primarily aimed at bridging the gap between patients and the healthcare system, including local support. Medicaid consensus is on the list. This is a process to kind of help with enrollment growth and other escalating factors in Medicaid that is part of just a normal process with the governor's office, legislative fiscal analysts, and ourselves. And then the WellCare visits are preventative healthcare visits for Medicaid members. Excuse me. So with that, I'll stop coughing and I'll shoot it over to Shannon Toman Black for an update from the Division of Continuous Quality Improvement.
All right, thanks, Nate. Joe, if you could give me a face, I would love to be able to add a face to my voice. And then just as an aside, Chanel Long from the Office of Substance Use and Mental Health needs to be added as a panelist so that she can present when their turn comes about. So we don't have a lot of big updates. We do try to let everyone know when we have organizational changes so you can be aware. So starting out, our quality management reviewers have new titles and classifications. They are now called external service reviewers, and Jessica Hooper, who is the supervisor, is the external service review manager. This isn't going to change any of their duties or how they'll interact with you or your programs. It just aligns the titles with their work. We also have two new external service reviewers, Andre French Lestray and Janet Heckelson. Their emails can be found on the org chart that I believe Joe will drop into chat. And yes, so you can get their email, and you can actually get any of our emails off of our org chart now. We added those in just so it would be a little clearer who to reach out for what and how to get in contact with them. Additionally, many of you already know this, but Kim Ontiveros has shifted roles and will now be working in the Division of Juvenile Justice and Youth Services. We are in the process of hiring her replacement, and we will let you know just as soon as that has happened. So that is all of our update for now. If you have any questions, again, feel free just to drop them in the Q&A box, and I will turn the time over to Shari Broomer for DCFS. Thanks, everybody.
So Shannon, I don't see Sherry on the call. Maybe we'll jump down to Chanel Long.
Hi, I'm here. Thanks, everybody. So a couple of updates from the Office of Substance Use and Mental Health. We've got an upcoming training, the Creating Safety training, which will be held February 9th. We will drop in the registration in the little chat box. So if you are interested or have other cohorts or community providers that are interested in attending that, you can go ahead and register. And then I also wanted to provide an update that our Generations Conference will be held May 22nd and May 23rd at the Salt Palace. Registration has not opened for that, but if you have staff member or other community members that usually attend the Generations Conference, please note that that is moving forward this year, and we're excited to bring that to you. And then we will also be hosting a peer support conference. I know a lot of you work with peers and have peers on your as employees. So we'll be holding that peer support conference June 8th and June 9th. And I'll provide additional details as we get closer to those registrations as well. And I also wanted you to know that we'll have other conferences coming forth with additional mental health and substance use trainings and education, and I'll provide those in this community meeting to make sure everybody knows when they're coming up and how to register for them. Thank you.
Thanks, Chanel. Just looking through our list here. Maybe we will jump to Daphne Lynch from the Division of Licensing and Background Checks.
Hello, everyone. Oh, good. You can see my face as well. So good things to announce. It is official. Carmen Richens is the director of the Division of Licensing and Background Checks. Meanwhile, can we see if Simone is on the call, because I know that he had some things that he wanted to discuss. Make sure he is up as a presenter.
Yeah, I'm adding Simone right now.
Perfect. And then as well, for background checks, you should be seeing relatively good turnaround times with those. We, because of the holidays and things, submissions slowed down. We were able to do kind of a lot of catch up with those, and we are excited about that. Just always remember, a completed background check is one that has been paid for, submitted fully. You press that submit button, and the electronic disclosure form has been completed, and the applicant has gotten their fingerprints taken. And that really is a fully submitted background check, and that's when our timeframes really start with those. I do not have any other announcements at this time, so I will turn it over to Simone.
Thank you, Daphne. Can you hear me?
Okay. Yeah, we got you.
We got you, Simone.
Thank you. I have a couple of updates. I don't know if this is part of the slides that you're going to present, or I can present my slide here.
Yeah, you're welcome to, Simone.
Okay, so there you go. I hope you're seeing it right now. Okay, so a couple of things. I believe you can see this slide right now. Can you see the Office of Licensing Rule on Compliance process?
Yep, you're live.
Okay, thank you. So we are implementing a new process for human services programs, and we call it the Office of Licensing Rule Non-Compliance process. It has been presented to different programs, but we are in the process of setting up appointments to present it to other programs who have not received this information. This is just a simplified tier process in which we are going to show a stronger system, and by stronger I don't mean punitive, but organized and simple to follow and to understand, in which we will follow 3 basic steps. I'm not going to read the whole document, but we can make this document available for anyone who has not received it yet. And the 3 steps are just to show what we use as preventive strategies to avoid lack of compliance, because the objective that we have is to help providers stay compliant with the rules. The second step will be just to see what we use to correct non-compliance. So we will explain everything that we do to make sure that providers not only understand, but also keep compliance. So the corrective actions that we are going to be using. And the third step will be what we will use to review any action that the Office of Licensing imposes. So we are trying to simplify processes, and the process to review our actions would be very simple. We will be giving the providers the opportunity to check with us in an informal process and ask us questions, or tell us if they are not in agreement with what actions we have directed them to take. So again, this document explains every single part of that process. Hopefully it is easy to understand. And again, we will be presenting these different meetings with different providers through this month and next month. Another piece of the information that I wanted to share with you is that we are switching providers to a different database and application, that will help us manage providers' compliance history in a more organized way. It will give us the opportunity to track histories of providers and give the public accessible information to providers' compliance histories. Many providers have been moving to this new application. Is called UCLAP, Utah Certification and Licensing Application, and it is created in-house. So it is the state's application. We're hoping that this is going to help us be more organized and be more accessible to not only to providers, but also the public. This application is also going to simplify processes. For example, applications, payments, and all those things will be online. Providers will not have to submit paper applications or paper payments in any way. So we'll be giving you more information about it as well. I'll be willing to answer any questions. It's just that I don't want to use a lot of the time. There is also a question on the chat that I am ready to answer, if that is okay. And it is about our processes. I totally understand that there has been some confusion sometimes for providers to know, okay, which rules do we follow? Do we follow licensing rules or another partner agency? We are in the process of clearing all these responsibilities and making sure that we don't overstep with our partner agencies, but at the same time that we clarify what our responsibilities are. The Office of Licensing will dedicate their efforts to make sure that the health and safety of every vulnerable individual is protected. That's what we will do. We're coming out with checklists and processes that will be clear to providers, and they will understand what is it that the Office of Licensing does. And the other partner agencies will also clarify their contracts and their requirements. Of course, there are some exceptions, for example, for medications for some provider types, but all that will be clarified. We will be working to make sure that our licensors are trained correctly to understand what is required and what is not required of every provider type, and if there are any exceptions for their services. That's all I had.
All right, thanks, Simone. Anything else from licensing and background checks? All right, we'll move on. Next, we'll have Rachel Edwards from JJYS.
Hello. I just have a few things. I just wanted to update everybody that Brett Peterson is going to be on a temporary assignment working with CSB. And so April Graham is been announced as the interim director for JJYS. So just wanted to let everybody know about that. We're hoping that Brett will be back with us in by July is what we're hoping for, but we'll see how that goes. Him and April are continuing to work together on some of our legislative session stuff. And so he's still here helping us out as well. And just a reminder, we have our family-based contracts out currently right now. So if there are providers that are interested in that, they can go ahead and get on the site and take a look at that. And that's all I have, Nate.
You know, it would help if I came off mute. You know, we've been doing this now for almost 3 years, and you'd think that I would have it down, but I don't. All right, so there was a question in the chat. What does CSB stand for? I can take that. So that's the Clinical Services Bureau. So those of you who have been following some of the press releases coming out of the Department of Health and Human Services, as well as the Department of Corrections, in the governor's budget, there was a proposal to move the Clinical Services Bureau, which is the kind of medical bureau that provides medical services for the inmates at the prison, the Gunnison site, from the Department of Corrections to the Department of Health and Human Services. So Brett is helping us lead a transition as we kind of work with corrections to identify the path forward to, you know, helping ensure that these individuals receive the care and safety that we strive for as part of our vision. So that is that. All right. So I will then jump to Jamie Woothridge from DSPD.
Thank you. All right, so I'm going to be really quick. I just wanted to, I think everybody knows, but for those of you who have been able to work with Bob Downing, you probably already heard that he has decided to retire. So we're interviewing for his position and we're hoping to announce a new hire soon. The other thing I wanted to bring up is the UVU Autism Conference. That is scheduled for February 23rd. And I know last time I wasn't able to put anything in the chat. I don't know if we can add links, but I have the, can we do that this time
Jamie,
around?
Yeah, Jamie, it's there.
Okay. And then just the, well, actually not the last thing, two things. I'm going to go back over what Nate already talked about. He just covered really quickly the budget with USDC and mentioned that he said that about 74% of the people that are residing at USDC have co-occurring diagnoses. And so that's been a big thing for the superintendent there, who's recently retired, Frank Reese, who was pretty passionate about serving people and addressing their mental health needs. It's probably been announced in several different venues, but Timothy Matthews is the new superintendent, and he is picking up that torch, and he's really focused on trauma-informed care. And we're hoping to see the team kind of shift as far as some of the things that they can offer at USDC, hopefully to see quick turnarounds and for people to get the support they need while they're there. And then the last thing is the SCE quarterly meeting is scheduled for January 18th. It's from 11:30 to 1. I think information about that has already gone out, but just for you to be aware, they're talking about the rate rollover, the legislative updates, and then there's a good training from the finance team. So I'd recommend attending if you can. And that is all I have.
All right. Thank you, Jamie. Let me pull back up my list here and see where we're at. All right. And then I think last but not least, Kim Kettle.
Thanks, Nate. Okay, I just have another just quick update. We will be providing 2 motivational interviewing trainings. One will be held in March and another one will be held in June. We do not have the specific dates yet. We are waiting at this point to make sure that we actually have the space. It will most likely be held at the Mesa building. So once we have that nailed down, we should have dates to be able to send that out. And there will be 25 slots per session in March and per session in June. And it is for clinicians this time around for both those options. And that's all I have. Back to you, Nate.
All right, thanks, Kim. So I think that concludes our report out period for the Department of Health and Human Services, but I am going to look to my team here on the call. If anyone has any mulligans or things they missed, we'll give you like a quick second to come off mute and run through that. If not, we can jump into the next section of our agenda. When I said quick, so we're moving on it. So no, I'm just all right. So we'll move on to the next section of our agenda today, which is our question and answer section. So please enter your questions into the Zoom chat, and we'll do our best to answer all of your questions. You can ask anything for any of the division representatives or myself, and it doesn't necessarily have to be related to our updates today. So we'll give you all a few minutes to enter any questions you may have, and if we don't have any questions, we will wrap up and give you some of your day back.
Hey, Nate, there was one question in here about the peer support conference and getting some more information. So Justin, we've grabbed your contact information and shared that with the team. And I guess one thing we should mention, Nate, is if the chat is not enabled for you, the Q&A function, Lillian, that you use, the Q&A function will work just fine for that.
Yeah. All right. So I will jump in and I'll just kind of read these off, and maybe I'll just assign it right here in real life to the person on the team who's probably best suited to answer that. So the question we have is from Benji. It says, when you say quick turnaround for background checks, what does that entail? Because we have been waiting 90 days plus on a regular basis to receive background checks. So I can turn that to Carmen or Daphne if one of you want to answer that.
That will go to me, Nate. So in our review and our look, we are looking at, as again, this is from when we have it fully submitted. So like I talked about, of having the application submitted, the paid for, fingerprints taken by the applicant, and the electronic disclosure survey side. From that day forward, we're looking, most are within a week. There is one caseload. I will admit it's the caseload that has been vacated by me being in the interim position. That caseload is still about 30 days, but all other caseloads are within 7 to 10 days. So if they're longer than that, I would like you to reach out to me and to Jeff Harris, which is the program manager, regarding those, and we can see why those timeframes are longer than expected.
Awesome, thank you, Daphne. There's been a couple questions in here asking for different links. I'm going to ask Joe's team if you all, when you send out the video for this, if you'll include the links, and we'll have our participants just send their links to Joe as well, so that he can include those in the email where the video is sent out.
Yeah, for sure, Nate, we'll do that.
Okay. The other question I have on here is from Shelley. It says, when will the mask mandate be lifted for residential providers? And I'm not sure who the best person to address that is, if they're even on the call. No volunteers from our team. Shelley, we can look into that and get back to you. I am not sure. My understanding is that it's kind of tied to case counts and some other kind of like population type measures within our state or within your county or geographic area. But I could be confusing that for a different type of residential facility. So we will have someone look into that and get back to you. All right. So got a question from Jackie Walters. What defines a clinician for the motivational training in May and June? I'm going back to our agenda here.
I think Nate, I think that was mine for the motivational interviewing.
Right. Okay,
Can you tell me that question again?
It says, what defines a clinician for the motivational interview training in May and June? So is it someone who's licensed, someone who's working on licensure? Is it specific to mental health clinicians, or, I mean, is it?
That's a good point. That's a really good question. At this point, it would be anybody who has a master's degree in being able to provide like mental health services. Does that clarify that person who that is? We in the past have not allowed students to be a part of that. They do need to be licensed, because usually the spots that we have that are paid for are hard to come by. So if they are a CSW, they could participate. Just if they are a student, they would not be allowed.
All right. I hope that provides some direction there. All right. It looks like that's all the questions we had submitted for today. So I am going to just move us along here and kind of wrap up for us. Thank you to everyone who joined us today, and thank you for your questions and feedback. It's really helpful for us knowing what questions you all have and being able to help provide you the information you need to do your job. So thank you for attending this call. Again, just to reiterate back to the housekeeping items, questions can be submitted anytime. You don't have to wait for these meetings. They may be sent to DHHS_CQI@utah.gov. And we can either share them in this message or respond back to you individually. And as I mentioned, submitting questions in advance helps us prepare answers and address your questions during the meetings. And we do look for an email with information about the next DHHS provider meeting. So thank you all for the help you do to help the children, youth, and families, as well as individuals in Utah. And we'll see you all at the next quarterly meeting.
Hey, Nate, just before we wrap up completely, we had 2 more questions just pop in there, and I thought maybe we could address a couple of those just before we wrap up. You okay with that?
I mean, I wrapped up. No, I'm just kidding. Yeah,
you did. I know. Okay, we're ending this meeting now.
No, of course. We'll take these questions. So the first question is, what is the status of the parent caregiver proposal like was given to spouses? So I don't know, Jamie, if you're here and want to answer that, or.
Sorry, would you repeat the question?
Yeah, it says, what is the status of the parent caregiver proposal like was given to spouses?
Oh, there was the 2 point, I think this is going, I don't have a slide in front of me, so I might have the figures wrong, but there was part of that what was unspent was swept over to caregiver comp. And then there's the request for an additional, I think, 1.9 million to try to get us through fiscal year 24. But just to remind everybody, that's just something that's part of the governor's budget and not necessarily something we're going to get.
Correct. Thank you, Jamie. Yes. So long story short, the governor's budget does include funding for parental caregiver, similar to the spousal caregiver, and we'll be working with legislators going forward on helping ensure we can lock down the funding for the upcoming year. And then Robert, I'm not sure I understand your question. Is it going out for public comment?
And Nate, he's referring to Simone's, the document that Simone shared, the Office of Licensing information.
Okay, Simone, do you want to address that?
Sure. I think that somebody asked about my email address as well, so I hope it was shared.
Yes, it was the same person. It was Robert.
Okay. So this document is not a rule. This is a policy and procedure for the program. So there is no public comment on it. However, we are receiving comments from the public because this is not set in stone. This is a process that we have implemented for the past 15 years in other programs. And if you have any comments or any ideas on it or questions, you're welcome to submit it to our office.
All right. Thank you, Simone. Got it. Okay. So with that, we will wrap up. Thank you all for your time today. We had an incredible 125 individuals on the call. We know that your time is valuable and appreciate you tuning in to share some time with us. And again, feel free to reach out if you have any questions, and we'll see you next time.